And we've been telling you for a while now about the really cool things going on at Broadlawns Medical Center. This is not the same Broadlawns you heard about 20 years ago, folks.
It's not, and you know, having been there not for a long time, this was a real eye-opener. And I think the thing that struck me most was the staff, how friendly they were, how much they enjoyed going to work and really got along with each other. But if you haven't been to Broadlawns in a while, take a look at this. We're at Broadlawns. I'm joined by the marketing director, Katie Wengert, who's here. And I guess the first thing that I want to convey to people, as someone who hasn't been here in over a decade, is how much this place has changed. It's a completely different environment here.
It's true. We've gone through quite a transformation in recent years. Where we're standing right now is our emergency department. It opened in 2010. We have state-of-the-art facilities which enable us to provide high-quality care for our patients in very, very attractive facilities.
Yeah, a lot of the rooms, the facilities are new, and a lot of the equipment is newer and better than what you'll find at the big hospitals in town.
I think there's a misperception that perhaps we don't have access to high-quality technology here, and that's a mistake because we do. We have state-of-the-art ultrasound equipment that was just recently added. We have the highest quality MRI machine and just very nice facilities in order to administer the care for our patients.
I would be perfectly comfortable and quite happy bringing any member of my family to this place. You know, we talked to the radiologist here who was showing us, as you mentioned, the new MRI machine. We've been to the new eye shop. The ER is all redone. The urgent care clinic is all redone. It's totally different here. And you sit in a place in town that's very, very pretty. Old trees, a beautiful campus. You're making some improvements out front of the campus as well?
Right. Construction is taking place right now on the eastern portion of our property. We're building a 72,000 square foot clinic building that will open in March of 2017. That will be the new home to our family health center, our dental clinic, and our outpatient behavioral health. We're also adding new residency housing. We have one of the oldest established family medicine residency programs in the Midwest.
Wow.
And we provide on-site housing for our residents to live here on campus. So we're getting new facilities for them as well. We had the opportunity to walk through the inpatient behavioral health department. Currently we have 30 beds for inpatient behavioral health. We're renovating that unit. Once the phase of construction is completed, we're going to move downstairs, which is our temporary unit, and make some additional renovations to expand our inpatient behavioral health by 14 beds.
We want to make it clear that you still serve the people you've always served here at Broadlawns, and that's your mission.
Sure. So we've been around since 1924. We are the safety net hospital. So, you know, our mission is to provide access to health care to everyone. We're not going to turn you away regardless of your ability to pay. You know, what has changed is that we've quietly transitioned to, you know, having providers that have brought their patients with them, and so people who have access to commercial insurance are choosing to come to Broadlawns now.
Yeah, and one of the reasons why is that you're able to provide the same services as the other facilities in town, oftentimes at a much lower cost.
Right. Our administration has really made a conscious effort to be fiscally responsible. They've cut expenses by about 35% to make sure that, you know, we're able to provide the lowest possible cost for our services that we provide.
What I'm saying, I guess, as a layman, is if you're able, before you have a procedure done, before you're coming to a hospital for whatever you need, check this place out and see if maybe you can get the same services from great people
right.
at a better price.
We agree. The staff that works here, you know, we're really committed to the mission of making sure that high-quality health care is affordable and accessible to everyone.
All right, Katie, thank you very much for your time.
I'm delighted to have you here.
And for the tour today, and I guess we'll just leave with come and give Broadlawns a look. It's really changed, and it's a wonderful place and a wonderful family here, a good place to go for your health care needs. Really nice. It's as nice as any hospital in town, and again, the people there are just thrilled to be there. I mean,
and the thing about it, I think a lot of people forget about it, to be totally honest with you, or they drive right by and they don't realize what an awesome facility this is, and the construction is nonstop. They got another project. They're just itching to get the other project started right now, too.
Yeah, a really great place. It was eye-opening to go there and see what they've done.
Yes, you might want to be thinking about Broadlawns in case anything goes down.